This month on the Taboo Topics podcast.
When you find that your quality of life is negatively affected, if you can't go to that swimming party, if you can't plan a vacation because of expecting your period, if you can't take a hike, but also if you find you're buying tons of tampons and pads, needing one every hour, that's when you need to call us.
Welcome to Taboo Topics, where host Mary Frances Emmons tackles awkward medical questions with Orlando Health's top health and wellness experts, getting the answers you've been searching the internet to find. Submit your own questions by emailing the letter r-podcast at orlandohealth.com or leave a 5-star rating with your question in the review section. This podcast is produced and sponsored by the healthcare leaders at Orlando Health.
Hello, and welcome to Taboo Topics, where we discuss embarrassing personal health questions and try to take the stigma out of those discussions. I'm your host, Mary Frances Emmons. Today we ask the question, why are my periods so heavy? My guest is Dr. Christine Greves, a board-certified OB-GYN with Orlando Health Women's Institute. Welcome, Dr. Greves.
Hi, thank you so much for having me.
So first, tell us a little bit about your work at Orlando Health and why this topic is important.
I'm an obstetrician and gynecologist, and this topic is so important because it not only affects a person who could be potentially having the heavy bleeding, but it also affects family. It can affect work, it can affect friends, it can affect activities, it can affect a person's life.
For the purposes of our discussion, what do we mean when we say, quote unquote, heavy bleeding? Does that mean a certain amount of blood a day or an hour or a period longer than a week? Or is it all of these things?
Yeah, great question. It can be all of these things. Actually, if you were to measure the amount of bleeding that you would have, if you bleed more than 80 milliliters during your menstrual cycle, that is when it's considered heavy. But not many of us have a teaspoon measurement ability. So basically, if it's a very, very heavy period affecting your life, if you find that you're changing your tampons or pads every 1 to 2 hours, or sometimes if your period is lasting longer than 7 days, that can be considered heavy. If you find that you're soaking through your clothes or your bedding, if you find that you're just feeling exhausted, short of breath, and tired during this time, and if you just find that it's excessive for you, affecting your quality of life, that's when it's heavy bleeding. It should not just be assumed as, that's my normal, I guess I just have to deal with it. No, that we're here to help with that, at least get it evaluated to try to figure out why, if there is a reason for it. And if you are amenable to the options that your doctor mentions to you, then you could gain in talking to us about that.
So why do some women bleed much more than others?
Yeah, that's a great question. There are many different reasons why some women may bleed more than others. One could be bleeding disorders. For example, there's a condition called von Willebrand syndrome, and that can affect someone's ability to clot. And that's typically discovered early on, like right shortly after you may start your period. If you notice that your bleeding is incredibly heavy, and if you go see your pediatrician or gynecologist, then that can be discovered by different bleeding tests. Other ways that people can have heavy bleeding is because of certain structural abnormalities like fibroids, if you've ever heard of a fibroid, polyps, endometriosis, hormonal imbalances, for example, polycystic ovarian syndrome, can disrupt the way that uterine lining is shed. Certain medications, like if you're on certain anticoagulants, that can cause heavy periods, and pregnancy can cause bleeding as well. Like if you have an ectopic pregnancy or if you miscarry.
What's a sign that you need to go and talk with your doctor?
Yeah, a sign that you need to talk with your doctor is when you realize this is affecting my life, or affecting your pocketbook with having to buy like more than 1 or 2 tampons every hour. When you find that your quality of life is negatively affected, if you can't go to that swimming party, if you can't plan a vacation because of expecting your period, if you can't take a hike, but also if you find you're buying tons of tampons and pads needing one every hour, that's when you need to call us.
What are some things you can do to address the most common causes? Because I know you just listed a whole lot of possibilities.
hmm So, what you can do is when you go see your doctor, you can tell your doctor about your bleeding. Then we can order an ultrasound, and that can help us figure out, do you have fibroids? What does the thickness of your lining look like? And then also order some labs in order to figure out, is there a thyroid concern? Are you anemic? Meaning, is your hemoglobin count, is it lower because of this? Like to see, like, is your body taking a hit? We can do an exam also, and we can see if it seems like you have active bleeding. Do you have a polyp or a growth that could be causing it? Are you in pain? Those are some things that we would do.
More on this after the break.
This episode is brought to you by the healthcare leaders at Orlando Health, where we deliver the future of medicine today. Orlando Health. Choose well.
So you mentioned anemia being a problem for heavy bleeders. How can you tell if you have anemia?
So, the way to tell if you have anemia can be certain symptoms or signs that you may show. For example, you may feel fatigue. You may feel exhausted, tired. You may feel like you look at the ice and you want to eat it, or a cornstarch, for example. That's called pica, P-I-C-A. When you notice those concerns, and especially if it's around the time of your period or shortly thereafter, bring it up to your doctor, because at the office, we can prick your finger in order to tell if your blood count is really low. And we can draw your blood. It's called a complete blood count, or a CBC. We can do that also to check your blood count.
You also mentioned fibroids being very common, and I feel like women of a certain age, mine, feel like everybody I know is dealing with this. But what is a fibroid, and how does that relate to heavy bleeding?
Imagine a ball, a small ball, sometimes a larger ball, that's trying to fit inside that uterus. And it needs to fit in various locations. Sometimes it fits or tries to go into the inside aspect and is called a submucosal fibroid. Other times it's on the outside, and those usually cause less concerns with the bleeding. But a fibroid is an extra growth. It's a conglomeration of smooth muscle cells that get together inside your uterus, and that can cause pressure if they're large enough, and that can really affect the uterus's ability to contract down and stop that heavy bleeding. It actually can contribute to heavy bleeding. The fibroid can, depending on the location and size.
So, one last condition I've read about but don't really know what it is fully is a PCOS. Is that common, and how does that relate to bleeding?
Yes. So PCOS stands for polycystic ovarian syndrome. And polycystic ovarian syndrome is a condition where, yes, there are little cysts around the ovaries. And there are a bunch of little cysts around the ovaries. The reason for it is because of a hormonal imbalance. But the PCOS, it does have cysts around the ovaries. It may or may not, though. So not only could you have cysts around your ovaries, but you could have irregular or absent periods. And when they come, they could be very heavy because they were irregular for quite a period of time, and there was a significant buildup perhaps. And when that period or that bleed finally comes, it can be heavy. Also with PCOS, there's evidence of excess androgens, meaning excess male hormones. So you may see acne. You may notice excess hair growth either on the body or the face. You may notice higher levels of testosterone if you draw the blood in order to see that, or scalp hair loss. Those are all some ways that polycystic ovarian syndrome may present. What I usually see in people when they are coming to me is they may have irregular bleeding, and then they may have complaints of extra hair growth on their chin or their belly button area, and they may have the acne. And whether or not they have cysts found around the ovaries or not, if they need only 2 of 3 criteria to be called PCOS or polycystic ovarian syndrome. And if someone has that, and we find that that can also be a cause for this abnormal uterine bleeding or the heavy bleeding when they finally do bleed.
So you've given us a lot of things to think about today. Is there anything else that you would want listeners to know about heavy bleeding or heavy periods?
Yes, just because you may have always had a heavy period, or just because your friend has a heavy period, or your family members have heavy periods, it doesn't mean that you need to tough it out. We as women try to do as much as we possibly can, but keep in mind there is plenty of help for you, or we would love to help you. So if you find that this resonates with you, just reach out to us and we're here to help you.
Well, thank you so much for being here today, Dr. Greaves, to speak about this taboo topic. Listeners, you can learn more about Dr. Greaves and her work at orlandohealth.com.
Thank you for listening to Taboo Topics. If you enjoyed this episode, please show your support by sharing with a friend and leaving us a 5-star review. Subscribe today to be sure you never miss an episode. This show is produced and sponsored by the healthcare leaders at Orlando Health. To find a doctor, walk-in clinic, or emergency room near you, visit orlandohealth.com.